Hypertension or high blood pressure, untreated, can lead to serious problems such as heart disease, kidney failure, and stroke.
That's why it's important to take steps to prevent and control hypertension. You'll hear some good advice on this week's Health Talk. We'll be up next. Hello, I'm Dr. Vicki Smetak.
And I'm Dr. Eric Mazur. Today we're going to discuss hypertension or high blood pressure with Dr. Allison Leff. She's an internist with the Norwalk Medical Group. Allison, you see a lot of patients. A lot of them, I presume, have high blood pressure. Tell us a little bit about high blood pressure. What is it? Why do people get it?
Well, the hardest thing about high blood pressure is that it affects all of the organs in the body. However, most patients never have any symptoms and are totally unaware that they even have high blood pressure.
I think that's a really important point. So a lot of people I know think nosebleeds or headaches may be associated with that, but not usually, right?
Not usually. Usually people find it incidentally or by going to visit their doctor on their routine checks.
Now, how much of that, you mentioned picking it up at a routine check. So a lot of people, I know myself included, are nervous when they go see the doctor. And I can tell you, my father, who's 76 years old, still is in denial that he has hypertension because he claims that it's because he was nervous when the doctor checked it.
Got a name to it, white coat hypertension.
How much of that is real, and how much of that can you tease out, and how do you take that out of the equation to say that somebody truly has hypertension that needs to be treated?
Of course, we do see this a lot. Oftentimes when people first come into the office, whether it's because they were aggravated right before they got there dealing with traffic, or just because they're nervous seeing a doctor, their blood pressure is high. What we try to do is have them rest in the office for a few moments before we check the blood pressure. If the blood pressure is still high, and this is the first time that we've ever really seen something like this, what we try to do is actually have them get some blood pressure readings while they're at home, in the environment where they're not stressed or scared that they're seeing a doctor.
Now, we had a guest on the show, I guess a year or two ago, was talking about 24-hour blood pressure monitoring and sending patients home with that as a much more accurate indicator of their blood pressure. Do you use that much in the real world of practice? And it seems to be a move towards that as a diagnostic maneuver.
Absolutely. We use ambulatory blood pressure monitoring a lot. What you can do is you can put a blood pressure cuff on, and the person will actually wear the blood pressure cuff all day for 24 hours. And the blood pressure cuff will usually inflate about every half an hour or so. In addition, it's actually been found that people checking their blood pressures in their home with their own blood pressure cuffs seems to correlate with the ambulatory blood pressure monitor. So if we can't do it for a 24-hour period, it's still important to get those readings at home.
How about the readings in the drugstore where you stick a quarter in the machine or something and you put your arm in a loop? Are they accurate? Are they useful?
They can be accurate. Usually what we try to recommend, though, is not basing any decision on one reading. It should be a series of readings.
That's a really important point. Now, getting back to what we had originally started by saying, you said that hypertension can affect all different organs in the body. What does it do? Why is this a big deal? Okay, so your blood pressure is a little bit elevated, or maybe a lot elevated, but you're not getting headaches, you're not getting nosebleeds. Who cares? Why is it a big deal? I know we care.
Of course. So because the heart and the arteries that flow back and forth to it go to every single organ in the body, anything that affects the heart is going to affect the rest of the body. So what we find is that people who have long-standing high blood pressure that is not controlled can have problems with their kidneys. They're at increased risk of having a stroke, and they can be at increased risk of having heart failure. I try to tell my patients that if they imagine when you go to a gym and you're working out and lifting weights, your muscles build up and get stronger and stronger. And in some cases that can be good. When that happens with the heart, because it is constantly fighting against the high blood pressure and the high resistance in the arteries, that can cause some bad things.
Yeah, I remember when people weightlifting, you'd say they get muscle bound. Well, high blood pressure really creates a muscle bound heart.
Right.
It doesn't contract as well, it doesn't fill as well, and even though it's sort of strong, it's thick when we look at it on the echo or on an X-ray, and I know on the electrically there's more electrical activity because it's so thick. It actually doesn't work as well because it's so muscle bound.
Right, exactly. So you don't want a thick heart.
You don't want a thickened
normal
heart. You want a normal heart, exactly. And the other thing that I find helpful, if you think about blood pressure, every time the heart pumps, the blood is sort of pounding against the arteries, which are elastic. And a lifetime of elevated blood pressure, those smaller arteries get damaged, and they begin to scar. They develop deposits of calcium and cholesterol, and that can lead again to kidney disease, stroke, and sometimes even rupture in the brain. And that's easy to understand, like a hose ruptures. If you have too much pressure going through that, or there's a weak spot in the hose.
Yes.
Are some people more predisposed to high blood pressure than others, Allison, would you say?
Yes, there are some people who are more predisposed to high blood pressure. It's believed that there are certain ethnicities, and this is based on clinical trials, that are at higher risk of high blood pressure. People of African American descent seem to be at higher risk of developing this. In addition, if you have a first-degree family member, either a mother or father, who has high blood pressure, you yourself are also at increased risk of developing it. And if you have two parents who have high blood pressure, you're at even more risk of developing it, irregardless of what your ethnicity may or not be.
So it's sort of hereditary, but it's not in many instances. It's sort of ethnic, but not. So you just need to know who is at the higher risk group. Now, people always think of strokes and high blood pressure, and that's true more in women than men, isn't it? But there lots of other stuff too. We mentioned them already: heart disease and kidney disease. But maybe you can say a little bit more about how damaging high blood pressure can be for these other organ systems that we often don't think about.
Right. So the high blood pressure, as we had mentioned, can cause the heart itself to fail, so that it won't pump as well as it should. And if you're not going to get the blood circulating and getting to the organs that it needs to, those other organs can be affected. So things like the kidneys can be affected, and people could have problems with kidney failure. So it really does affect everything in the body.
Vision as well, right? It can affect the retina, and people can have some visual changes because of long-standing high blood pressure.
Yes, and when you go to the eye doctor and they look at your eyes, they can actually see if there are changes associated with high blood pressure.
Again,
on their exam.
speaking to those changes in the vessels that we were talking about, because those vessels keep seeing that high pressure over time. Is that the mechanism by which that happens?
Yeah, they get
Yes.
more rigid, and they get deposits in them, and we talk about copper wiring and silver wiring. The vessels actually look different when you look into the eye.
Yes.
Now, there are also some people, we should say something about high blood pressure in diabetics, because diabetics are particularly susceptible to some of those complications.
Yes, so people who don't have any medical problems, it's still very important to control high blood pressure. But there are some other people who have other medical problems, for example, diabetes. So people who have diabetes have the added stress of the blood sugar potentially causing problems with the arteries and vessels in their body. Now, if you add on this, high blood pressure, those are two things that are working against you. So we usually recommend in our diabetics that they have their blood pressure controlled even a little bit more than we do the general population.
Okay. How about high blood pressure and cholesterol? Similar recommendations if somebody's prone to having high cholesterol? Is there any sort of link and association or different guidelines pertaining to that individual than to someone who doesn't have cholesterol problems?
Of course, we would like to, the more other medical issues that you may or may not have, it's even more important to control the blood pressure in those cases, especially because high blood pressure alone causes increased risk of heart disease. Now you add on to that something like high cholesterol, which we also know causes that,
Right.
and you really want to make sure that you're treating both of these things well.
Yeah.
The double whammies, and then people often add on smoking,
Right.
and lack of inactivity, and obesity, and there are so many things then conspiring to give us heart disease and stroke, which is why these are so common in our society.
Are we seeing folks presenting with high blood pressure at younger ages now because of the obesity epidemic that we are experiencing as a nation? Would you say that you're seeing younger folks in your practice who maybe not in the best shape, who are now having high blood pressure, who maybe don't have other risk factors?
We are seeing that. There is a correlation between obesity and high blood pressure. So as the obesity rates have increased, so have the rates of things like high blood pressure, and of course, as you mentioned before, diabetes and high cholesterol. There's a lot of associations with obesity, and we're definitely seeing an increased rate of high blood pressure.
I think the
Yeah.
good news about obesity is if you lose the weight, you may reverse your high
Right.
blood pressure. Have you ever seen that in your practice?
I have. As a matter of fact, I have several wonderful cases of my patients who have undergone significant weight loss, either with a gastric bypass surgery or just by diet and exercise alone. And all of a sudden, they are able to get off of their blood pressure medicines. They're able to get off of their medicines for diabetes. And the studies have shown that your blood pressure, just by reducing your weight, even by 1 to 2 pounds, brings down your blood pressure by 1 to 2 numbers. So this obviously has an effect on you, and overall it's better for your well-being.
And I think before we leave that topic, I think you alluded to something that's really, really important. I think people who have a lot of weight to lose are sometimes daunted by that tremendous chore ahead of them. But as you said, you can lose just a small amount of weight, 5, 10 pounds, and change your response to insulin. In other words, you can improve your blood sugar management, you can improve your blood pressure. So you don't have to lose every pound right away. Just a little bit makes an enormous difference in your health.
Yes, and it's very exciting when you see that in your patients.
And that gives them incentive to continue then, right, with their good habits and lifestyle changes.
So when you see somebody in your office with high blood pressure, you've confirmed it on several visits or through home monitoring, what's the first thing you do?
So one of the first things that we do is we really try to institute lifestyle changes. So we had spoken about obesity and weight loss, and that is one aspect of things which can actually have an impact on you. Just by increasing your exercise, even if you're not losing the weight, if you do 30 minutes of exercise most days a week, you will see your blood pressure start to come down into the better controlled range.
And that can mean just walking for somebody who's sedentary.
Yes, absolutely. It doesn't mean you have to go to a full Zumba class for an hour. It can be just walking around the block for half an hour, several times
There's
a
some
week.
recent data that showed that you can reduce your risk of dementia, that you can reduce your risk of stroke. It's extraordinary how effective a little bit of exercise is on a regular basis in keeping you healthy.
Yes. And people oftentimes have a block in their minds that they can't fit in that time during their very busy working days. So try and do it in increments over the day. 10 minutes here, walking up and down the stairs during lunchtime. That counts.
About 2 years ago, I made a vow not to use the stairs unless there was a reason to. So now I walk 5 flights of stairs routinely several times a day, and you don't think about it. That's all we have time for in this segment, but that's a good note to leave on. Exercise is good for you. I'm sorry that you have to hear that again from us, but we talk about that all the time. We'll talk more about exercise, high blood pressure, treatment, and all of that after this short break, so stay tuned.
Salad on Saturday, fruit on Friday, Norwalk Thursday, water Wednesday, touch your toes Tuesday, let's move Monday, swap us next Sunday. 60 minutes of physical activity a day and eating well can help get your child healthy. So keep them active and eating well every day. Get ideas, get involved, get going at letsmove.gov. That's letsmove.gov.
We got the spirit, we're hot, we can't be stopped. We got the spirit, we're hot, we can't be stopped. We're gonna beat them and bust them. Beat them.
The smallest moments can have the biggest impact on a child's life.
Let's get a little bit rowdy. R-O-W-D-Y.
Take time to be a dad
One more
today.
time. Oh, those boys are much too much. Those boys.
Bring out the action hero in you. Fuel up right and get energized. Be part of the greatest action movie ever. The first movie that puts you in the action. Show us how you train and eat like an action hero. Join in at actionheroalliance.com.
The first 30 seconds are all I remember. My doctor told me I had cancer. When the shock was over, I met with a cancer specialist at Norwalk Hospital. We weighed all my options: surgery, radiation therapy, chemotherapy, even the latest clinical trials. Their Whittingham Cancer Centre offered me personalised care, hope, and leading cancer physicians. And I know great care. Besides being a cancer survivor, I'm also an ICU nurse, and I chose Norwalk Hospital.
Hi, Vicki and I are back with Dr. Allison Leff. She's an internist with the Norwalk Medical Group, and we're talking about high blood pressure.
So we talked a lot about what it is and what it can do, and we know all the damage that it can do to our body. How do we treat it, Allison?
So there are a lot of options. As we had mentioned before, we try to discuss lifestyle changes, the exercise, the diet, watching your sodium intake.
The salt.
The salt. You want to keep that to about 2.5 grams a day. In addition, watching your alcohol intake, making sure that you're not having.
That's a
more
really
than
good
2
point. I
grams.
always forget about it, so it's really good that you mentioned that. According to some people I've worked with, the most common cause of resistant high blood pressure that they've seen in their practice is people who drank too much. And it's something you don't often relate, and it's really common, so I'm so glad you mentioned that.
So ideally, we would like to be able to do all these things, not just because of high blood pressure, but because they're healthy for you.
And it doesn't always work also. You could live a very clean life and be a teetotaler, you still may have high blood pressure.
Yes. So in that case, we have to start talking about different medications. And there are a lot of medication options out there, and a lot of different medications that you can try.
And the medicines have been actually shown to prevent these complications, haven't they?
Yes, some medications in certain situations have been shown to prevent complications from high blood pressure. There's a class of medications that we use and we prefer to use in people who have diabetes. So if you have other medical conditions, it helps sometimes to lead the physician to decide what medicine might work best in your case. And it should be a personalized decision.
And we were talking during the break, there are just an extraordinary variety of different types of medicines now for high blood pressure. So it really allows the doctor and the patient to reach a very individualized solution. We were saying that back when I was in training and early on in my career, there were 2 or 3 medicines. And you didn't have a lot of choice, but now there are calcium channel blockers and ACE inhibitors and angiotensin receptor blockers. There's so many ways that we can tailor a regimen that we should be able to find a regimen in the vast majority of people.
Yes. As a matter of fact, because there are so many different options, it's very important that if you start a medication and you think something may have changed or you may be having a side effect from it, that you talk to your doctor about it. Don't think that you have to stay on a medicine that you're not tolerating well.
Sure. Now, Allison, do you get resistance from patients when you broach that topic of having to start on medications for blood pressure when they may be feeling perfectly fine, right? Because we talked about how it doesn't really give you symptoms. So are there some folks who respond sort of negatively to the thought of having to take a medicine when they feel okay?
Of course there is. It's hard to remember every day to take a pill.
Right.
And you have to take your medicine every day, otherwise it's not going to have the benefit and you're going to see your blood pressure fluctuate. So there is resistance to taking medicine for people who otherwise feel well and have no other medical problems. So I find that it's important to just continue to maintain the dialogue, continue to talk to the patients and try and explain to them and show them what the effects can be. I have patients who say they would never start a medicine because they're feeling fine. And then all of a sudden they start it and they come back about a month later and they said, you know what, I didn't realize it, but I guess I really wasn't feeling fine before.
Because now I feel better.
Because now I feel better.
That's interesting. And you can say that about a lot of chronic conditions where you don't realize that something's happening, but then you feel so much better when you're on the appropriate therapy.
Right.
That's a good
Again,
point.
the problem with high blood pressure usually is that there are no symptoms, and the complications can be many years down the road. So we're not talking about kidney failure that occurs 3 weeks after you're diagnosed with blood pressure. We're talking about it years and years later. It can take 10, 20, 30, 40, actually 10 would be quick.
Right.
20, 30, 40 years before you develop these complications.
Yeah. Lifestyle modifications you talked about a lot, quitting smoking, for example, adding exercise, changing diet. Do you find in your practice, would you say that a lot of your patients are able to make those modifications and sustain them? I'm just curious because it's hard for all of us, right, to do those things and be consistent about it. What have you found in your experience?
Well, including me.
Yeah, and me, and I'm sure I don't want to speak for you, Eric, but I think it's a challenge that we all
I
face.
refer to my daily exercise routine as my torture time.
Well, I find that when patients see a response and they start feeling better, that it's easier for them to continue doing the correct things. And it's important for them to know that if they have a slip up, if they stop going to the gym, for a couple of weeks, that they can restart again, that none of these decisions have to be permanent.
Right.
It can always be a gradual process to reach a goal.
Yeah.
Also, among the patients, high blood pressure is so common, and so I'm sure you have a number of patients with this problem who you manage. What are the common mistakes that patients make that we can tell people about who are at home listening to us and watching us, hopefully?
So the common mistake is to make sure that you are taking your blood pressure medicine every day and that you want to do it at the same time. So the other issue is that patients will run out of their medicine. So you want to make sure that you have plenty of the medicine and that you don't leave it until the last pill before you call in for a refill.
Okay.
I think one other thing that we probably should emphasize is that managing blood pressure with medications lowers your blood pressure, but it doesn't cure your blood pressure problem. So if you stop taking your medicines and you haven't lost weight, your blood pressure is going to go right up. So you're not curing people by these medicines, are we?
Right. Antibiotics can cure an infection, and you won't have to take antibiotics for the rest of your life. Blood pressure medicine you usually need to stay on for the rest of your life.
Yeah, but the benefit is that you're protecting your heart and you're protecting your kidneys and your eyes and all your end organs from pretty significant damage, as we've been saying.
Right, absolutely.
Now, most blood pressure problems that we come across as internists are essential blood pressure problems. In other words, we call it essential hypertension. We don't know of a specific cause. But there are some diseases that cause specific diseases that cause blood pressure problems. That is not the rule, it is the exception. But maybe we should mention them just for completeness sake.
Sure, there are some other reasons that people can get high blood pressure. The majority of these seem to be related to endocrine, so the glands in your body. They produce hormones, and if those hormones are either too high or too low, that can affect your blood pressure. In addition, there's the opposite effect where people who actually have a problem with their kidney first can develop high blood pressure. Not just that high blood pressure can then develop a problem with your kidney.
Right. So there's this entity that we call renal artery stenosis. Young women can get it as a result of an unusual disorder where the vessel leading to the kidney gets scarred and is smaller, and correcting that can cure the blood pressure problem then.
Absolutely, as can correcting some of the endocrinology issues. It can lead to a cure for the blood pressure.
And we also know that young people can get high blood pressure, children even, right, and adolescents, partly because of the obesity epidemic. Again, kids and adolescents.
That's a really important point, Vicki. So when, as a pediatrician, when would you start testing children for high blood pressure, and when would you even treat them if it's high?
Well, hypertension is screened for now pretty routinely. I mean, blood pressure measurements are taken in the pediatrician's office with each physical, Eric, and to your point, if there's one reading that's elevated, it'll usually be rechecked, and then the child will be brought back again maybe a few weeks later to confirm that that was truly a correct reading, to see if there is a pattern, and then it would be acted upon, absolutely.
So if there's a child with a consistently elevated blood pressure...
Oh yeah, that is a reason to investigate further. Is there a renal issue, like you mentioned?
Kidney, yeah.
Right, a kidney issue, and that would generally warrant a referral to a specialist. If the child is obese, then obviously that area would go down that pathway toward better nutrition and weight management.
Really important information, because high blood pressure is so common and it is so manageable and it can prevent so many devastating diseases. So I want to thank Dr. Leff, Allison, and when we come back we're going to have today's health question.
Right now, let's take a look at some of our upcoming events sponsored by Norwalk Hospital. tell.
The first 30 seconds are all I remember. My doctor told me I had cancer. When the shock was over, I met with a cancer specialist at Norwalk Hospital. We weighed all my options: surgery, radiation therapy, chemotherapy, even the latest clinical trials. Their Whittingham Cancer Centre offered me personalised care, hope and leading cancer physicians. And I know great care. Besides being a cancer survivor, I'm also an ICU nurse, and I chose Norwalk Hospital.
Nice. No. Oops. Yeah, sure. Let's go.
Moms everywhere are finding ways to keep kids active and healthy.
Works every time.
Get ideas, get involved, get going at letsmove.gov.
Mom, can I have $1? Yeah, it's right. I think my purse is upstairs on the bed. It's not here. Check the dining room. No. What about your sister's room? It's not there either. The upstairs closet? The downstairs closet? There are no more closets.
Moms everywhere are finding ways to keep kids active and healthy. Get ideas, get involved, get going at letsmove.gov.
Here's this week's viewer question. What is the difference between bad cholesterol and good cholesterol? And thankfully, we have an expert here, an internist,
How can
Dr.
cholesterol
Allison
be
Leff.
both bad and good?
Yeah, so tell us, Allison, what are some of the differences? What is good cholesterol versus bad cholesterol?
So whenever we do a full cholesterol panel and test our patients, we test many different kinds of cholesterol. The good cholesterol, as you mentioned, that's the one we like to have around. Believe it or not, it can actually be helpful. It can actually protect your heart, and it can counteract some of the effects of the bad cholesterol that you have. Typically, if you were to look at a report yourself, you'd see that the good cholesterol is labeled as HDL. And we like to say the H is because we want it high. The LDL is the bad cholesterol. So the L is for low. We want that number to be lower.
That's a good mnemonic for patients who are looking at their health, and now more and more people are looking at their health information and accessing it.
And mechanistically, we can think of it that cholesterol exists in our body linked to other carrier proteins or transport proteins. And the HDL actually takes cholesterol away from the cells lining the arteries, whereas the LDL takes cholesterol to the cells. And you don't want too much cholesterol building up in your arteries, so you want to be taking cholesterol away from those cells, but not transporting it to those cells. And that is why cholesterol, we need cholesterol to live.
We need it, right? We have to mention that
We're made of
cholesterol is a good
cholesterol.
thing.
Our cells are made of it. So, so there is a really big difference between HDL and LDL.
What's a cutoff, just real quick, Allison? What's a number that you shouldn't go above in your LDL?
You really,
or range?
The recommendations actually have been fairly recently modified. We used to say that an LDL of 160 was okay, but that has been found actually to not be the case. So for the majority of people who don't have any other medical problems, you really don't want to go above an LDL of 130.
Okay.
And that's all we have time for. The lower the better with LDLs. So if you have a question you'd like to ask us on Health Talk, please contact Vicki and me at healthtalk@norwalkhealth.org.
We would like to thank our guest today, Dr. Allison Leff, for coming on our show, and we'll see you next week on Health Talk.
And keep your blood pressure down, exercise,
And
lose
stay
weight,
healthy.
stay healthy. Bye-bye.